let's hand it over to someone who doesn't have a background that's artificial, and we'll begin today's opening statements with Mayor Ed Holder. Mayor Holder.
Well, thank you, Dan. It's good to know that politics is not artificial. And good afternoon, everyone. So look, it's another day of record high case counts in Ontario. And while not a record here in London, our numbers locally continue to trend in the wrong direction. You know, I always try to approach these updates with sometimes brutal honesty, supported by facts on the ground, while at the same time presenting that information alongside what I like to call credible hope. So in that vein, I think it's worth noting that when it comes to cases per 100,000 per week, London is still doing significantly better than any mid to large city in Ontario. But at the same time, we have to acknowledge that our rates are increasing rapidly. We are truly at a crossroads here. We still have time to get this under control and once again work to flatten the curve. I think it was back in late spring and the entirety of the summer where we had numerous days with very low to zero case counts. And now it's certainly not lows and not low single digits. All businesses that were open then are open now. So what's changed? Aside from the weather, it's us, our behavior. The businesses haven't changed. We might be done with the virus, done in the sense that we're tired, we're weary, but clearly it is not done with us. We need to get back to that earlier level of vigilance, that earlier level of accountability. And I know people are tired. And I know we've been preaching this for months and months and months, but I say again, the things we need to do to physically distance, to practice safe hygiene, to watch our crowd sizes, do the things that were back then, it seems like almost an eternity ago, when we were at the lower numbers. Look, getting to lower numbers is by no means out of reach, but it takes a commitment from all of us on behalf of each other if we're to be successful. So on a more positive note, I want to share with you some very exciting news. The City of London has made significant progress in the effort to end veteran homelessness in London, and we are now on track to become the first community in Canada to achieve what's called, quote, functional zero veteran homelessness. That doesn't mean that there are no veterans that are homeless, but we're certainly tracking in a very positive direction. You'll remember in July, London was recognized as the first community in Canada to achieve a real-time list of all veterans experiencing homelessness in the community. Since then, our homeless prevention and housing team has continued responding to the specific housing needs of veterans, and between August and September, we've achieved that to reduce the number of veterans experiencing homelessness by over 75%. This accomplishment brings us significantly closer towards our goal of ensuring that no veteran continues to experience homelessness in our city. To accomplish this, our team is looking to hear from the landlords, property owners who are able to offer affordable, transitional, or permanent housing to veterans in our community. While we are close to achieving our goal, we know this important work must continue as we make an effort to eliminate all chronic homelessness in London. That work is so vital, and I'm incredibly proud of our team here at City Hall and for all those who are involved in their incredible efforts. So that's it for me, Dan, for this moment. Back over to you, please.
Thank you, Mr. Mayor, and I will turn it over to the Associate Medical Officer of Health, Dr. Alex Summers.
Thank you, Dan, and thank you, Mr. Mayor. Good to be with each and every single one of you today. We are reporting 23 new cases of COVID-19 today. But as we've said before, it's not the daily counts so much that matter, but what the trends have been. And the trends in the Middlesex and London region, indeed across the province, have been consistent. We have seen rising number of cases over the last week and the preceding week as well. And as we see those cases, further to the mayor's comments, we have to ask ourselves why. We are certainly seeing increased transmission in indoor environments where people are less than 2 meters and unmasked with people who aren't within their immediate household. We aren't seeing transmission in our schools. We aren't seeing transmission in our long-term care homes or retirement homes, but we are seeing it in places where we find ourselves after school or after work or on the evenings or the weekends. So as we see the case count that's reported today, we look at that trend and we start to remember that although we are over the pandemic, it is not in any way over us. As we go into the weekend, I think it's important to talk a little bit about exactly what we mean when we say have close contact only with those within your immediate household. This is not the weekend, nor is this the month to have your neighbors over into your home, nor is it the time to hang out with your extended family if they're not within your immediate household inside your home. It's a time to have physically distant hellos or virtual greetings. It's time to harken back a little bit to what it was like back in the spring, where we were so able to drive down the transmission and flatten the curve by making sure we were really keeping that distance between one another. So as we go into this weekend, and as you're making plans for Friday evening or Saturday evening or even during the day, make sure that you're not having those indoor gatherings with people who are not in your immediate family. In doing so, we can all try and do our part to try and bring the curve back down, because it is certainly accelerating. And as we look across the province, although we are in somewhat better standing than others, it is only indeed a matter of time if we don't take some of those lessons hard learned since the beginning of the pandemic to heart. Thank you so much again for the leadership that's been provided in this community. We've done an amazing job. It's exhausting, we're tired, but as we look into the weekend and as we look into the rest of the month and onward, we have to recognize that this driving incident rate requires further action and staying the course. With that, thank you so much again, and back to you, Dan.
Thank you, Dr. Summers. Thank you, Mayor Holder. It in some ways doesn't seem so long ago, the spring, that we had those measures in place, and yet it seems like a lifetime ago as well. Enough of that. Let's get on to the questions, because we do have several of them, gentlemen, so let's get to them right away. Dr. Summers, the first question is for you. It comes to us from Steve Young at CTV London and News Talk 1290 CJVK. Dr. Summers, for the 7th day in a row, we have recorded double-digit positive cases of COVID in our region. How high does it have to go before tighter restrictions are imposed by either the health unit or by the province?
Thank you for that question. We monitor, obviously, very closely a series of things, including case counts, the percent positivity of the tests that are done in our region, the type of transmission that we're seeing, particularly if we're seeing outbreaks in certain areas. And we also look across the rest of the province at the trends in our neighboring jurisdictions, or of course, up highways closer to the GTA. Taking all of that together is what informs the decision to impose greater restrictions. And of course, that's a decision that can come in many different forms and does not simply involve the health unit arbitrarily deciding. It's around conversations that we continue to have with local leaders as well as with the province. The framework that was released last week by the province articulates what some of those steps may be, and we continue to have dialogue with the province around what we are seeing here on the ground. What is very clear is that we have metrics, be it incident rates or percent positivity of tests or outbreaks. We have metrics that suggest that we require more restrictions in place here locally, and we will be working to determine how best to make that happen. However, we know that the province is listening, and we know that we're working hard in the meantime on the ground here to make sure that we follow up on cases, we contact, and we work on outbreaks to make sure that we limit transmission as much as we can.
Thank you, Dr. Summers. And let's go to the next question. It's also for you, and it comes to us from Jane Sims at the London Free Press. Dr. Summers, there has been criticism today of the provincial government not sharing the details of the new framework with the medical community before implementing it. As someone on the public health measures table, this actually was written with the expectation, I think, that Dr. Mackey was on the briefing today. So I'm going to modify your question a bit, Jane. So did you see the framework before it was announced by the government? Do you have concerns about the benchmarks?
Thank you, Jane. Certainly, the framework that was released last week at the health unit, and certainly for myself, I became aware when it was released by the provincial government. And certainly it was helpful to see what the government's approach to rising incidence rates and other rising metrics of increased community transmission might be. Certainly, as a local public health official, as someone who is now gaining greater experience, of course, working in a pandemic environment, the earlier we act, the better for us in a lot of ways. And we recognize that as transmission increases, it is a bit of trying to chase a snowball in some ways. You want to get ahead of it rather than get behind it. And so as we look here locally at what we can do to make sure that we are preventing things as opposed to reacting to things, we look for opportunities to act earlier rather than later. And of course, we continue to have these ongoing discussions with the province and others to make sure that we are all on the same page about what type of interventions, and what type of interventions will be effective and when they will be effective. Thanks, Dan.
All right, thank you, Dr. Summers. Our next question comes from Andrew Graham at Global News Radio, AM 980 CFPL, and it is for you, Dr. Summers. During Monday's briefing, Dr. Mackey had mentioned that he anticipates Middlesex-London would move into the next tier, yellow, of the province's color-coded category system for COVID-19 measures. Do you anticipate the same move? And if so, do you have an idea when that might happen?
Thanks for the question, Andrew. Building off of the comments from Monday, given the metrics that we are seeing here locally, I also anticipate that we will be moving into an escalated category. The timing of that, of course, would be determined at the provincial level. We'll be monitoring very closely over the next couple of days in order to determine exactly when and if we will be moving, but I anticipate that such a direction may be forthcoming.
Thank you, Dr. Summers. The next question is a follow-up from Jane Sims at the London Free Press. Dr. Summers, this question is about contact tracing. Have you been able to keep up, and at what caseload level would contact tracing become strained?
Thank you again for that question, Jane. From a case management and contact tracing perspective, the health unit continues to be able to keep up. We're able to notify and contact nearly 95 to 100% of cases and contacts within 24 to 48 hours or less. However, if we see cases continue to rise, we will certainly shortly feel the strain. We are already feeling that strain, I must say, although we are managing to get done what we need to get done. As a health unit, we've been working over the last number of months to create capacity and processes that allow for us to respond to escalating and increasing number of cases. However, of course, there is a point in time in which that is going to be increasingly challenging for us. However, as we sit here today, we are still hitting those metrics, and my kudos and thanks to our teams for the tremendous work in making that happen.
Thank you, Dr. Summers. And yes, the teams are working incredibly hard in following up with all of those cases, identifying those close contacts, and doing that important work that's going to help us to limit the further spread of the virus. So yes, to all of our colleagues here at the Middlesex-London Health Unit, hats off and great job. Next question. There are two questions here, and they are from Kirat Walia at the Western Gazette. And I think, Dr. Summers, these are probably for you. Mayor Holder, if you have a comment you'd like to add. But let's go with Dr. Summers to start. Dr. Summers, what is the status of the COVID-19 outbreak in London Hall at Western? And also, have any Western student cases been connected to Halloween parties?
Thanks for that question. The outbreak in residence on Western campus is now over. There's been no additional transmission that has been seen in that setting following the declaration of that outbreak, what is now a number of weeks ago. Similarly, when we look at the repercussions of the Halloween weekend, we have certainly identified cases associated with close gatherings, none specifically associated with any in particular Halloween party or gathering. What I would emphasize is there will be opportunities to, there will be times coming up shortly, particularly as we get into the December holiday season, where people will recall that this is a common time of year to gather and have parties. And whether it was Halloween or Thanksgiving before that, and whether or not it's the upcoming holiday season, end of term, you name it, times of year in which we would typically have a party, get together, celebrate, We cannot do that this year. And whether or not we're able to specifically link a case back to a party or not, there will be transmission associated with parties. I can tell you that much. When people get together during a pandemic, when they're not in each other's immediate family, we run the risk of transmission. And over the course of our population, over the size of our jurisdiction, we will see transmission in those areas, whether or not we can label it or not. So as we go into the weekend, as we go into the months ahead, it is time to cancel those parties, even if you'd already planned them. And unfortunately, whether or not we can link them directly or not, we know transmission will happen should those events occur.
Thank you, Dr. Summers. Mayor Holder, just in follow-up to Dr. Summers' comments, did you have anything that you might like to add in terms of advice to people who maybe already have been planning some of those gatherings?
Well, I think in specific, I think Dr. Summers has articulated our concerns about gatherings, particularly outside of one's home and or being invited to someone else's home. We're just asking people not only to resist, but to reject those thoughtful invitations. I would add as well that the cooperation we have had from Western, both from students, the USC, and administration has been stellar. And we appreciate their cooperation as we've worked to deal with the issues. London Hall's already been referenced, and no additional comments needed there. But that cooperation is absolutely integral to what we're trying to do.
Thank you very much, Mr. Mayor. And to everyone tuning in, I mentioned the tip of the hat to the staff at the Middlesex-London Health Unit. And of course, I would be remiss to not mention all of the frontline workers who have been working so diligently and with such passion and dedication as we have been working through the pandemic, to all of the doctors, the nurses, the paramedics, the emergency EMS staff, long-term care staff, hospital staff, and if I've missed you, I apologize, but you have been instrumental in this effort, and we thank you for it. Gentlemen, I am going to take one last quick look at the questions, and yes, we have no others in line. So that takes care of it for today. We'd like to thank you for tuning in for this afternoon's virtual media briefing. Thank you, Dr. Summers. Thank you, Mayor Holder, for your time and your insights and your thoughts this afternoon. We'll be back with our next virtual media briefing next Monday afternoon at 2 o'clock. So between now and then, have a great rest of the day. Enjoy the weekend, and we'll see you next week. So long.